Hello, good afternoon, everyone. So can you hear me well? Just to make the proof of sound. And then also I'm going to share the screen. Okay. Yes, thank you. I'm going to share my screen. So thank you very much. I'm going to start presenting. So I would like to start giving some introduction why integrated surveillance is so important and why this project is going to support integrated surveillance. So as you know, AMR is a natural phenomenon, is part of evolutionary and ecological process. Microorganisms adapt to the current selective pressure. One of the most important drivers for antimicrobial resistance is the antimicrobial use. And there is selective pressure everywhere, in the water, in the soil. We also give antimicrobials to animals, to plants, to humans. So there's simply nowhere to hide from the impact of antimicrobial resistance. So that's why integrated surveillance is essential for tackling antimicrobial resistance. There's international recognition that integrated surveillance is an essential tool for generating evidence. International recognition that comes from several years ago, for example, with the publication of these guidelines for integrated surveillance from the AGISAR group from WHO. But then also there are several international experiences, different countries doing integrated surveillance. For example, we have programs like the European Union, the ECDC, EFSA, European Medicines Agency, in which they, for example, correlate the use of antimicrobials in animals with resistant infections in humans. There are also publications showing how the trends of antimicrobial resistance in animals are decreasing with interventions that are tackling a reduction on antimicrobial use at the national level, for example, in the Netherlands. So we know that integrated surveillance is essential, not only across sectors, but also across different types of data, correlating antimicrobial use, main drivers with antimicrobial resistance, to evaluate the effect of interventions. And the last piece of international recognition on integrated surveillance has been the adoption of the guidelines on integrated monitoring and surveillance of foodborne AMR by the Codex Alimentarius. And this is one of the major advancements of last year. Thanks to this, we have like a higher level guidance on how countries can start implementing their work on integrated surveillance. And this is basically the main focus of this ACT project, the Antimicrobial Codex Text project, is going to be in supporting countries, the main beneficiary countries, but also at the global level to implement these guidelines through practical tools. So I would like now to move on what is the FAO contribution to this project. As my colleague Jeff was explaining before, ACT is in the intersection between the action plan and the codex texts. So the action plan on antimicrobial resistance is offering a programmatic approach for the organization, for FAO, to implement this work. The action plan has 5 objectives. One of the main objectives is strengthening surveillance and research. And within this objective of strengthening surveillance, we have 3 main major outputs. One is on building laboratory capacities through the deployment of assessment tools, external quality assurance, procurement of reagents, etc. We also have one output on building surveillance, monitoring, and research capacities. And here is where we have frameworks, the Codex guidelines on integrated surveillance, post-Atlas implementation for generation of roadmaps for action for countries, etc. And then the action plan in 2021 was also giving a very clear mandate to FAO and the establishment of data services and epidemiology capacities. So there's been generation of data over the last years, and now we are trying to focus on how to utilize this data, how countries can use the data for generating evidence and to assess their interventions. So that's why we received the mandate also to start the development of the INFAM data platform, which I'm going to talk about later, and also the development of TISA. So under this project and under this specific output, the output number 2 of the ACT project on building surveillance capacities and developing practical tools for implementation of the Codex text on integrated surveillance, we have several activities. We have activities on giving a situation analysis and assessment of what's the situation of the surveillance system in countries. We also have activities for strengthening the AMR residue monitoring capacities, activities for strengthening laboratory capacities, including trainings, external quality assurance, etc. And then I'm going to focus especially in this presentation on the development of practical tools and materials, how this project is going to support these practical tools and materials, and also how this project is going to support the operationalization of national surveillance networks through the participation in this global initiative, the INFAM data platform. So I start with the assessment tools. I'm just going to give a very brief notes on this. So a few years ago, when the first action plan on antimicrobial resistance was initiated in FAO, the organization realized that the countries were not producing data. The capacities are very limited. Still, they are very limited in many low middle income countries. That's why the tool for assessment of laboratories and AMR surveillance systems, the FAO Atlas, was developed. And over the last years, it's been implemented and deployed in more than 45 countries and more than 170 laboratories. Basically, this tool is mapping and assessing systematically the organizational and technical capacities of AMR surveillance systems and AMR laboratory networks. And it's basically helping to prioritize the activities and actions that the country can do to move forward in a progressive improvement pathway, in a PIP, in which they basically, countries are assigned with a PIP stage in which they can evaluate their performance and their advancement in the capacities for laboratories and surveillance systems. And of course, there are this tool is one of the tools that the project is going to support in the deployment. Is going to be deployed in several countries, has been already deployed in Mongolia, and soon it will also be deployed in Bolivia and Colombia. As I said before, that in the last years, there's been a lot of focus from the organization to generate the capacities for the countries to generate and to develop antimicrobial resistance data. But now we need to do something with this data. We need to also support countries on how to use this data. And this traction and the support to start developing these systems for these data systems is also coming from the tripartite, from the quadripartite agencies. And I'm going to quickly introduce that as well. So on the World Health Organization, they've been collecting antimicrobial use and antimicrobial resistance data in humans for several years. And they're putting this information under the GLASS system, the Global System for Surveillance of AMR and AMU. This is information from humans. Then on the WOHA side, on the World Organization for Animal Health, they are collecting antimicrobial use data at the national level for terrestrial and aquatic animals. And they've been collecting this data for several years already. They also produce reports on a regular basis, and they also have launched a data platform which is called Animuse for the collection of this antimicrobial use data. And what is the responsibility of FAO here in this picture? FAO is basically responsible for the collection of antimicrobial use in plants, so the use of antimicrobial pesticides, but also antimicrobial resistance in animals and food. And the organization, and as I was saying before, until last year in 2021, was not receiving this mandate. So now we have the mandate to start collecting this data, to start developing a platform, a system. So we see a clear information gap between the different organizations. And these different systems, so the GLASS system in WHO, the Animuse in WOHA, and the future INFARM in FAO, the three systems are going to contribute with data on an annual basis. Aggregated data will be shared with the Global Integrated System for Surveillance of AMR and AMU, which was initially called TISA, the Tripartite Integrated System for AMR and AMU. But yeah, we probably call it global because we have new partners in the quadripartite. Now we also have UNEP, and probably they are also jumping in the integrated surveillance. So that's why we probably changed the name. This is still in discussion, but it was previously called TISA or might be called GISA. And with the purpose of covering this mandate, the mandate of the organization of FAO, and also covering the information gap, we have initiated the development of the International FAO Antimicrobial Resistance Monitoring, the INFARM data platform. This platform is currently on the development phase. We are going to initiate the testing of the first prototype very soon, and maybe in a couple of weeks we have finalized internal testing, and countries will be able to start sharing their data and testing the functionalities of the platform to give us feedback so that we can refine refine the platform and the data platform, and probably doing a global launch next year, in which we will open a call for data in a similar way as the GLASS system is doing. So we are close to finalizing the pilot testing. As I said, during this year until 2022, the end of 2022, and then there will be this global rollout. And here is the visual identity of our design team was generating for us. You can see here in the left, in the shape of bacilli and cocci, you can see the bacteria. So this is the data generation side. The data generation side goes into the central eye of surveillance, and after the information, all the data is processed, it gets transformed in information that is shared in a harmonized way. That you can say this is depicted also in the right side of the slide. So the main purpose of the platform is to support countries in collecting, analyzing, and using their AMR data from animals and food. So supporting the national level capacities, but then also to support countries that want to share publicly AMR data from food and agriculture sectors for global surveillance as a public good for international advocacy and action against AMR. So all the information that countries want to make public in the infant platform is the information that we will also be sharing with the tripartite integrated system, the TISA system, with the quadripartite. But of course, in food and agriculture, there are different surveillance domains. We are working with surveillance in food and agriculture can be seen in different angles. We are not just doing active surveillance in food commodities and animals through the food chain from the public health perspective, but we are also doing surveillance on animal pathogens, passive surveillance in animal pathogens. And of course, there are several gaps there. For example, the interpretation criteria they are not very well developed. But what we know for sure is that there are different surveillance domains, and we need to prioritize. So prioritization is key, and we are going to start focusing on the generation of data and the sharing of data in the platform from priority bacterial species of interest to public health, animal health, and also indicator bacteria, which are the bacteria and the recommendations that are set up in the codex text for foodborne antimicrobial resistance. And for the platform, we understand that there are different levels of development in countries. Some countries are doing they are doing surveillance in food and agriculture in a systematic way through systematic monitoring and surveillance programs, but some others are just starting with pilot experiences. They are just having the collection of 200 samples in poultry farms in the country just to initiate the experience on surveillance. So from the very beginning and from the inception of the platform, we'll be accepting officially validated data from both systematic surveillance and also pilot surveillance activities from point prevalence surveys, for example, or research studies. And the idea is also to get information on the contextual information. For example, the platform will also have a repository of documents in which countries can upload surveillance strategies, national action plans, SOPs, and TORs of the different groups, the governing bodies responsible for surveillance in the country, etc. So the idea is to get contextual information around this data that we'll be sharing the platform. The core objective is to support countries in the collection, analysis, and visualization and interpretation of the data, so the use of their data. And for these countries, we'll have access to a private interface in which they can share their data in complete privacy, and we will not be made public if they don't want, so I will explain this later. And then there will be also a public interface. That is the interface that will be sharing the information with the TISA system, with the tripartite integrated surveillance system on an annual basis when the information is aggregated and the open call is closed. So the principle of development of the platform is also to offer flexibility in the levels of confidentiality. We understand antimicrobial resistance data is a bit sensitive, and countries might want to choose different levels of how they participate in the initiative. So for this pilot testing, we have developed in the platform 3 different ways of sharing information. They can share at the private level only. Basically, they can only see the information, and they can only see the visualizations for their own country. and they will not have access in the private interface to the information from other countries, and they can share information publicly. When they want to share information publicly, they can do it in two ways. They can do it showing their country identity, which is the public level 3, or they can also decide not to show their country identity, in which, and then basically for this, what we will do is to create aggregation and aggregated visualizations at the sub-regional and regional levels. So this is for countries to decide. This is also for us to test the willingness of countries to participate, ideally in the level 3, which is the one which is most useful for integrated surveillance at the global level. And it will also make us will also enable us to make comparisons, for example, with the data of GLASS, the antimicrobial use and resistance data in humans, which is disaggregated at country level. We have a long list of specifications from the platforms. We have different types of users. For example, we have the FAO coordination team in headquarters that will be responsible for management of users, giving access to the different users, the visualizations, the data migration on an annual basis to the TISA, and also to get to follow the publication and information sharing cycle, because there will be an annual cycle of publication of this data. Then we have the FAO representatives. The FAO representatives are FAO colleagues around the world, in the regions, in the sub-regions, and in the country offices that can support countries directly in the uploading of the data, in the cleaning of the data, and also they can also access the visualizations for supporting countries on the interpretations. Then we have the main actors of this movie. The main actors are the country infant focal points. So the country infant focal points are the nominated persons in the country to be sharing the data, to be collecting the data from at the national level on an annual basis, and to be sharing the information with the infant platform. And then, of course, we will have the global users. The global users will only are any user on the internet that can access the application through the internet to see the visualizations that we are going to be producing through dashboards. So what are the benefits for countries to participate in this initiative? They will have a safe place where to store the data with restricted access and the possibility to share data at different levels of confidentiality, as I was explaining before. They also have easy tools to analyze and interpret data. So the moment they upload the files with antimicrobial susceptibility testing results coming from the laboratory, they will also, in a lapse of 48 hours, they will have access to interactive dashboards. So the data will be transformed in information, different dashboards for visualization of tables, maps, and figures with their data. Of course, there will also be a one-stop shop with a repository of documents to contextualize the information at the country level. So national surveillance plans, protocols, reports of the application of the FAO assessment tools, for example, reports from the application of Atlas tool, etc. And of course, what we expect from the participation is that countries participating in this will improve the coordination in the data collection. Just the sole nomination of the infant focal point starts generating like a structure in the country to collect data on an annual basis and to put it together to be shared with the platform. And also, we also support the analysis and harmonization of the data, because what we have is what the platform only supports data that are coming from a template. So this template and this data model is the one that all countries need to use to share data in the platform. So what are the long-term plans for the InFarm? In this year, 2022, we are developing, piloting, and validating the solution, the IT solution. So we want to test with countries. So far, we have received a nomination of infant focal points from around 20 countries around the world. From all these countries, these 20 countries, maybe not all of them are going to share antimicrobial susceptibility testing data, but some countries might be sharing this data, and these are the countries that are going to test all the functionalities of the platform when we give them access very soon. In a couple of weeks, we can start maybe giving access to them. In the year 2023, after the validation of the solution, we want to do a global rollout. We want to do an open call for data, an open call that can last for several months. For example, from April to September could be an example. During these months, countries are invited to submit data to the platform. And during this time, we are also going to provide trainings to the countries that are interested in getting trainings on how to fill the Excel templates, how to fill how the information has to be shared with the platform. Of course, in parallel to this, we are also developing the interoperability with data management systems. The Infarm is a data platform, it's not a data management system. So in many countries, we need a data management system, a system that basically helps countries to manage the data, to put it in the correct format to be shared with the platform. And for this, we have initiatives like the HUNET from WHO and other laboratory information management systems. We are building also the interoperability with these data management systems so that they can export directly the files in the format that Infarm platform will be accepting so that they can upload the information in the Infarm platform. And in the year 2024, the idea is to start including other surveillance programs, expanding the platform to other surveillance programs, because the platform is not going only to collect antimicrobial resistance from the public health perspective in food and agriculture sectors, but it will also collect antimicrobial use in crops. So the use of antimicrobial pesticides in plants. And then we are not, just wanted to finalize saying that we are not going to make this alone. We have a we have a collaborative network of reference centers, FAO reference centers of antimicrobial resistance that are distributed around the world. They offer technical advice to the organization, but they are also there to support as advisory bodies for the organization in all the activities we do on surveillance as well. And of course, we also have at the regional level other collaborations. We have FAO regional networks that have been established specifically for surveillance. For example, technical advisory groups in Southeast Asia and in East Africa. There are two technical advisory groups covering several countries. And then we also, important here is to mention the quadripartite collaboration. We also have our partners in WHO, in WOHA, in UNEP. We are developing initiatives like the TISA, like the Global System for Integrated Surveillance, but we are also, for example, establishing a group of experts from all around the world. There will be a group of experts, 35 experts, around 35 experts, that will be providing guidance on how to do integrated surveillance at the global level, providing guidance to the global leaders group, but also to countries, specific countries, like, for example, the countries under the Multi-Partner Trust Fund, but also countries that are participating in other projects like the ACT project. So this group of experts at the global level on integrated surveillance will also be providing tools and practical recommendations on how to implement the Codex text, for example, on integrated surveillance. In addition to this, I would like to focus now on the development of practical tools and materials, because this is also one of the main activities of this project. The idea on this project is to also build on what has been already developed. So under different projects in the organization, we have developed frameworks. For example, in Southeast Asia, there is a framework for doing surveillance across different surveillance domains in food and agriculture. We will build on this framework. For example, recently, in the region, they have an Excel template that has now been adapted and has been categorized according to the Codex text on integrated surveillance for foodborne AMR. So we are going to build on the initiatives that are existing, like these initiatives in Asia, also thanks to the support of this project. So if we put in a pyramid of the different levels of practical details that guidance around the world are giving for integrated surveillance, in the top of the pyramid, we have the Codex Alimentarius guidelines, also the WOHA standards. So we have the standards. This project is also going to support the development of a handbook for early implementation of Infarm and its contribution to integrated surveillance. This is work in progress, and it will also be developed thanks to this project. And then, of course, as I was saying before, we have guidelines on the implementation of specific surveillance domains that have been produced around the world. And then with even more level of detail, we have specific protocols for the implementation of integrated surveillance. So this project is going to be covering this gap and also to support the participation in the Infarm initiative. Just to make a comparison, if we put it in this pyramid, is the Codex guidelines and all the standards that have been developed around the world on surveillance. are like the cookbook for ingredients. It's just giving the ingredients on how to do surveillance. And then there is a need for more specific technical level of detail on how to implement this high-level guidance, which is like basically the recipes. One things are the ingredients, and the other things are how you cook this recipe for doing integrated surveillance in countries. So just to finalize, and this is the last slide, thanks to this project and thanks to all the projects we have in the house, but especially thanks to this project, we are going to be able to support different activities on surveillance and especially on integrated surveillance that are helping to do all the journey that AMR data is doing. So from the overarching design for the data management and generation of data to the analysis through platforms like the Infarm, transforming the data into information for generating findings and evidence that are going to be transformed in policy recommendations to support the overall pillars of the action plan, to support responsible antimicrobial use, good practices, and for increasing awareness of antimicrobial resistance. With this, thank you very much, and apologies for the cats, and I'm sorry for the hackers in the interrupting a bit the presentation. Thank you so much.
네, 감사드립니다.